So we know that a good night's sleep is absolutely imperative to waking up in the morning energized and replenished. And unfortunately, too many kids don't breathe properly at night. So what this device does is immediately helps them to breathe better at night and forces nasal breathing, getting more volume of oxygen. And brain scans of children will show that the brain function with a bad night's sleep and with a good night's sleep literally changes the way that the brain works. So without a doubt, this device can improve brain function exponentially by just simply sleeping with this in. I know it's absolutely that simple, but really does help get better oxygenation. So regarding airway issues, we know that the palate supports the sinuses, and a lot of kids are growing up today with narrow faces, narrow archways, because they didn't have to fight for the baby milk. Maybe the breastfeeding wasn't done as much as desired, and so they have these narrow arches. And so the V-Bite, what it does, is going to help them expand their palate anywhere between 1 to 3%, according to the reviews and science on this. And by expanding the archway and also opening the bite, but also forcing nasal breathing, it's literally going to expand airway. And this will help children have a lot more oxygenation of the brain and of the entire body, which is imperative for regeneration and performance. So your kid will literally wake up with more energy, more focus, and hopefully will behave better at school. This is a problem that affects almost 99% of the pediatric population, according to some data. So this is not something that's rare or random. So we really need to engage with parents and teachers and the schooling community as well, because sadly, a lot of these kids get put on medication for their attention deficit disorder, which could be as simple as an airway issue and not a psychiatric issue. And sadly today, if a kid is performing bad at school, isn't focusing, we're attributing this to, a drug-related issue or the lack of something, a substance in the brain, and we're giving these kids medication, then what they really need is a good night's rest and proper breathing. And this device is a non-medical, it's super safe, it's got no phthalates in it, it's got no BPAs in it, it's considered one of the safest and most tested sleep devices on the planet, with over 4 million children treated successfully. What if it's as simple as this, that your kid gets to have better school performance without the need of medication? So one of the cool things about the V-Bite device is that changes and improvements can occur within the first few weeks, meaning you don't really have to wait a long time to get the immediate impact of the device. In my case, I can tell you that my 4-year-old, the nights that she forgets to wear it or that it falls out of her mouth, she wakes up more grumpy. So in my own experience, it's almost immediate, the cause and effect of this. So you will start seeing improvements in your patient's child's overall health and energy and activity almost immediately. So just a couple of weeks, the results already kick in. So for what you're paying for this device and the potential benefits are just, it's unbelievable. I run the clinic, I own my clinic, so naturally we're always looking for new business opportunities as long as they can, bring better health to our patients. And in pediatric dentistry, this is something that is incredible because, with a small investment, you can have a couple of these in your stock. And with a small questionnaire that comes with the V-Bite, you can immediately provide the parent with this device for these kids. And just the feedback has been phenomenal. It's a great practice builder. It's a very small investment to have. There's no downsides, no side effects. There's nothing negative that can come from this. So it's a risk-free device. And the worst case that can happen is that you have a parent that the kid isn't compliant. But from a medical standpoint, there's no negative side effects. Of course, there's a bunch of competitors on the market, and the device is a little bit premium, so it's a bit more expensive. but studies will show that these cheaper devices manufactured in China or abroad actually aren't as safe as the Bee-Bite, which is manufactured in the US. So obviously you are paying for a premium product, but most parents don't mind paying a little bit more to make sure that their kids have the healthiest and best decision. One of the greatest practice builders we've had here at the White Clinic in many, many years. It's a no-brainer. So another great feature of this is that you don't actually need to do any exercises like a lot of other competitor products. The act of swallowing with this in, because of its very, very exclusive design, patented design by the way, is enough. So all it takes for this to reap its full benefits is that you have to sleep with it in. So all it takes is an average child will swallow 2 times a minute during the daytime and about 1 time a minute at night. And just the simple act of swallowing will allow this device to do its full function, its myofacial function. It's that simple, so no extra exercises needed. If the child isn't compliant at night, we would recommend that they use it in their screen time or when they're reading or when they're traveling in the car. So when they're awake, but not actively talking or eating, just to get used to the device. But the compliance of this device in our hands over the last 3 to 4 years has been almost 99% of compliance with parents. So all in all you have to do is wear it and it works. So how do you know which one to use? Or, well, basically these devices go from 2 to 12. They're very simple. You don't need any specific impressions. They're not custom made. So they're prefabricated, obviously, in the US. So with a simple sleep and speech questionnaire to be filled out with the parent, pretty much very rapidly you'll understand which is the ideal Bee-Bite appliance for your patient or your child. That sleep questionnaire is really, really well thought out and will help the provider immediately understand if there's a need for it and which one.